Not every psychotic break is schizophrenia. Sometimes it's your immune system attacking your brain. Anti-NMDA receptor encephalitis looks like psychosis at first. It looks like paranoia, hallucinations, mood swings. But within weeks, it can turn into seizures, movement disorders, even coma. This isn't just psychiatry. It's the immune system hijacking the mind. Imagine you're 23 years old. 1 week ago, you were in college, laughing with your friends, going to class. Now, you're paranoid, hallucinating, and screaming at your parents that the nurses at the ER are trying to kill you. Doctors say it looks like schizophrenia. It looks like your first psychotic break. But what they can't see is that your immune system has turned against your brain. This is anti-NMDA receptor encephalitis. Welcome back to Psychiatry Rewritten. Today I'm talking about a condition that lives at the crossroads of neurology and psychiatry. It's called autoimmune encephalitis, specifically anti-NMDA receptor encephalitis. It's a disease that begins like psychosis, but can quickly spiral into seizures, catatonia, and even coma. And the thing is, if doctors miss it, the client may never recover. But if they catch it, and they treat the immune system properly, the brain has a chance to heal. This story and this condition forces us to ask, how many people labeled as schizophrenic are actually fighting an autoimmune attack? The early signs of this condition are almost always psychiatric. Sudden anxiety, paranoia, hallucinations, delusions, strange mood swings, and insomnia are common. The doctors might see a young woman with new onset psychosis and think, schizophrenia, slam dunk. They admit her to psychiatry. But within days to weeks, things shift. The body starts to join the storm. Seizures erupt. Memory collapses. Her movements turn bizarre, like rigid postures. Her lips are smacking. Her body's thrashing. Sometimes these are called orofacial dyskinesias. Then autonomic chaos ensues. Blood pressure spikes, heart rate drops, temperature drops, or is very elevated. Some patients slip into coma. On the surface, it looks like a psychiatric emergency, but underneath and with the vital signs, it's the immune system dismantling NMDA receptors. The very receptors that allow neurons to communicate with glutamate in our brains, and glutamate is the brain's main excitatory signal. So what is happening biologically? NMDA receptors sit on neurons like little gates, letting calcium and sodium pass when glutamate binds. They're critical for memory, learning, and perception. In anti-NMDA receptor encephalitis, the antibodies form against those gates. They bind to NMDA receptors and cause them to be pulled off the neuron surface. The brain is left with a massive receptor deficit. The result is glutamate chaos. The circuits are now misfiring. Psychosis is emerging. And as the attack continues, whole networks for memory, movement, and autonomic control begin to fail. And that's what results in the thrashing movements, in the facial movements, in the dyskinesias. So the condition was first clearly described in 2007 by Dr. Joseph Dalomieu and colleagues who noticed a cluster of young women with psychosis, seizures, and ovarian teratomas. Now, teratomas are tumors that contain neural tissue. The immune system, in trying to fight off these neural tumors, these neural tissue tumors, was also attacking their brains. It couldn't tell the difference. But it wasn't until 2012 that the world really noticed, because this is when journalist Susanna Callahan published her memoir, Brain on Fire. She told her story of being hospitalized at age 24, nearly locked into a diagnosis of schizophrenia until a doctor suspected autoimmune encephalitis. She received immunotherapy and she recovered. Her case and the Netflix film adaptation brought global awareness to this condition. Anti-NMDA receptor encephalitis can affect anyone, but it's most common in young women, often linked to ovarian teratomas. Men and children can also develop it, sometimes after infections or viruses, sometimes for reasons we still don't fully understand. It's rare, but not astonishingly so. One large study found it's the most common form of autoimmune encephalitis worldwide. And importantly, it is treatable if caught early. So how do we tell the difference between first break psychosis and autoimmune encephalitis? Well, some red flags include a very rapid onset, fluctuating levels of consciousness, seizures or unusual movements, autonomic instability, memory loss that is out of proportion for a psychiatric illness or a sudden onset psychiatric illness. The workup involves testing cerebrospinal fluid and serum for NMDA receptor antibodies. So basically just tapping into your spine and then testing the CNS fluid. And then EEGs are performed, which can often show a distinctive extreme delta brush pattern that can be indicative. And then MRIs are performed, which may be normal early on, but can later show inflammation. And that inflammation can be used as criteria for diagnosis. Treatment is about calming the immune system. Steroids, IVIG, or plasmapheresis is used sometimes. If a teratoma is present, surgical removal of the teratoma is critical. Second-line therapies that include specific medications are used in resistant cases. And with proper treatment, 75 to 80% of patients recover significantly, but delays in diagnosis can mean death or permanent disability. Anti-NMDA receptor encephalitis teaches us something vital. Not all psychosis is psychiatric. If Callahan's doctors had stopped at the schizophrenia diagnosis, she wouldn't have survived. It took one doctor and someone willing to see beyond the DSM to question the label and to ask, what if this isn't a mental illness at all? It's a reminder for all of us, clinicians, clients, families, to stay curious, to remember that the brain and body are inseparable, and sometimes the cure for psychosis isn't an antipsychotic, it's treating the immune system. That simple shift in perspective can be the difference between lifelong disability and a full return to life. It's a reminder that psychiatry doesn't exist in a vacuum. The mind and body are inseparable, and sometimes saving someone's mental health means looking at their immune system, not just their brain. That's all for this topic. Thank you for being here. I'll see you next time.